Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
Welcome to today's edition of Helping Seniors Television. This is the show that's designed to inform, educate, and connect you to resources that are going to help you on your aging journey. I'm Kerry Fink, and our founder of Helping Seniors organization, we're a Florida nonprofit, 100% local to Brevard County, Florida. Joe Steckler was our founder, and he always talked about everybody's need as a family to make an aging plan. And we talk about that a lot. I've heard other people call it's similar to a hurricane plan, means that you don't really want a storm, but what you do want to do is be prepared for anything that might be coming your way and know how you're going to deal with that as you move down the road. Significant value to being able to do that. It's a lot less stressful. You have a lot more options and, quite frankly, a lot more peace of mind when you're prepared, because at least you know you're going to activate a plan, not just have to try to think one up on the spot. And so with that, one of the things that I want us to get ahead of, we call it getting your ducks in a row. It's kind of a fun way to think about it. We just want people to plan ahead. After 15 years of answering the Helping Seniors phone number, which is that free call, I'm going to give you that number, so grab a pencil and jot this down. It's also going to be on your screen here. It's 321-473-7770. I'll say it again, 321-473-7770. The reason for that phone number is that last year we took more than 4,000 calls from seniors and their families about everything. We get calls, housing, medical, legal, financial, transportation, you name it. We take the call on it, and our role is to try to assist that caller to navigate to something that's going to improve that. And through that process, we learn that the more that we can learn ahead of time, the easier it is going to be for families to navigate. So I'm so excited to introduce our guest for today. Her name is Tami Leeberg, and she's an ARNP, which is a fancy acronym for meaning that she's an advanced registered nurse practitioner. Is that close?
That's correct.
Okay, good. I always get that a little bit twisted, but I want to make sure I get it right. But not only are you an ARNP, but you're a board certified geriatric nurse practitioner, which has a lot of meaning for everything we try to do in the Helping Seniors world. Can you talk a little bit as we get to know you? You've been friends with the Helping Seniors organization for a long time, but as we get to know you better as a practitioner, how did you come to the idea of not only being in healthcare, but specifically that I really want to help senior patients?
Well, my background was EMT firefighter for Indy Atlantic to start with, and then I was an ER tech back at Holmes Regional Hospital before Health First was around. Yeah. And then I got my LPN and then my 2-year RN, and I was still in acute care, so in the hospital in a subacute setting. And then eventually I moved to Indiana. Mm-hmm. And during that phase of my life, I helped open up the first Alzheimer's and dementia unit. It was called Friends Fellowship in Richmond. And that was my second job. So I was scrubbing as an LPN in surgery during the day. And then I did that as my second job before I had kids. And I fell in love with the senior population. So many years later, once I finished my master's degree, I decided to go into geriatrics, and I had a practice in Indiana for about 3 years before I moved back to Florida, where my family's all at, to do geriatrics.
I was thinking as you were talking about your background working with dementia and Alzheimer's patients, Joe Steckler, who was our founder for the Helping Seniors organization, he organized this nonprofit after he'd built up the Brevard Alzheimer's Foundation. To this day here locally, they call them Joe's Clubs, the adult daycare centers. And I remember when I met Joe literally 15 years ago, we've now been doing Helping Seniors. And he said, Kerry, what I learned is, he said, many families do have challenges with cognition, but he goes, every family has challenges with aging. And we need an organization that's able to help fit those gaps, help navigate folks to where they're going. And I kind of see that as a role that you're very, very good at. In fact, the topic of our show today is transitional care, but I also want to allow a few minutes as we get towards deeper into the program to talk a little bit about something that you do, which kind of is related to all that first part we were talking about, which is memory screenings and the kind of help that you're able to provide there. But let's jump into transitional care, because that's what we titled the show. And I don't want to make an assumption that we all really know what transitional care means. I know enough to be dangerous that maybe I'm coming out of the hospital and I'm going to have to spend some more time at home. But let me ask you to explain what we mean by transitional care.
So when I was doing primary care, one of the things that when I opened up my new company, which is Senior Solutions Mind and Body, I thought really hard about what I needed as a primary care provider, because our geriatric population is growing, as we all know.
Yes.
And so I wanted to do something that filled those gaps to help the seniors. So transitional care is something that also Medicare encourages us as primaries to do. But a lot of times we're so busy as a primary taking care of their acute needs, we can't really do the transition, or it's hard to get into. So transitional care management is once you have had a hospitalization or a hospitalization and then a rehab stay somewhere, and you are being discharged back to your home or an assisted living facility, that transitional care visit, we would come out to your house, and it is to bridge the gap between a hospital and rehab and the time that you can get back into your primary care person. A lot of times seniors are readmitted to the hospital. 1 in every 5 seniors in the first 30 days get a readmission.
Wow.
And a lot of those things can be preventable because it's either they didn't realize they were supposed to come home on a certain med, or their medications were changed in the hospital, but it's not really explained at discharge, or you get so much, the patient and families get inundated with so much information at discharge that it just gets confused. So you're not on the right medicine. Or the hospitals say you need to have physical therapy, but you have to have an order for that. And you don't get the order from the hospital. You have to get it from your PCP. And you may not be able to get into your PCP for, 3 weeks. So those first few weeks, you could end up back in the hospital for a lot of things that could be prevented. So the transitional care visits do that. We go out, we do a med rec, we order home care if needed, and it's very patient specific. So what patient A needs is not what patient B needs. And we fill those gaps and make sure those needs are met, and then turn them back over to their primary.
It's interesting because I was thinking about our own personal experience as caregivers for our moms. And I do remember early on in the process, following a hospital stay, they basically walked in and say, okay, mom is ready to go home. But we need a few things, and they give you it feels like they're giving you a phone book full of instructions, and you're so busy getting mom safely home, back into bed so she can rest and all the things, and you're busy running and waiting and doing all the things that you need to do, that it's going to be quite a while before you're able to dig into those papers. And then you're like, oh my goodness, I was supposed to do this, or I might be missing this. And it really seems like, they're having you sign all these forms and all these things, but when do you really get a chance to look through them? And then if you're like me, maybe you don't even understand half the things that are being asked of you.
That could be also, yes. So we do go out, we work with the families and the patients. A lot of the assisted living patients have some sort of cognitive impairment, so they may not pick up on it right away. A lot of our patients, because I did mobile primary care for a long time, a lot of our patients have family members out of state. So they might be flown in just to bring them home, or they may go to the hospital, stay a few days, come back, and their family's still not here.
Wow.
So then they go back to the assisted living, and then that falls on them. So we work with the assisted living staff really close to do that also.
Yeah, I was thinking because, it seems to me like sort of the progression of this is somebody goes into the hospital. One of the first questions they do when they're bringing you in is they want to know every medication that you're on, and they want to know about all that. So you do the best you can to give them that information. But then on the flip side, when you come out, sometimes they send you home with prescriptions, or we need you to do this and this and this and this. So you've got that. So you're trying to manage everything that you had when you went into the hospital. Then you have all this other stuff, and it seems like it's very easy to get confused. Like, am I supposed to delete something on this list or add something over here? And then maybe you get so busy getting your person set up to be comfortable at home, maybe you can't get out and figure out what I need to do. Go talk to your drugstore or your pharmacist and figure this out. That seems to be an area we need a lot of help in. That seems to be an area that you do help us in transitional care.
Yes, that's one of our main goals, is to make sure that the medication that you are discharged with is actually the medication that you will be taking. Because a lot of times, something simple as, say that you took Pepcid at home for heartburn, but then when you go into the hospital, they may have changed that drug to something on their formulary. It does the same thing, but when you're discharged, it's probably going to have their drug. So then it's like, do I need this drug or do I need the drug I was on? And and it's all those things that it's, and usually when you come home from the hospital, you're still not feeling great.
Yeah.
And so there's a lot, and it was a huge gap that needs filled, and that's one of the things that we're going to help with.
Yeah, thank you for saying that, because I was thinking that's a part of the equation too. Is we always have this corollary in the helping seniors world where we say, don't try this on your own when you can get really good help. Because even if I'm trying to be a diligent son and I come home with this phone book worth of material from the hospital, I'm trying to read through it, says, okay, I'm supposed to get this prescription filled. And so all the best I can do is be kind of robotic and just make sure if it says I'm supposed to get this prescription and now mom is supposed to take 2 of these and according to whatever the schedule is, I can probably manage that. But possibly I don't even know what I'm doing. I'm almost like a monkey, just,
Right.
Whereas you come in and you can look at the whole thing and go, this is exactly where we need to be going.
Yes. And a lot of times too, families don't realize that there's like private duty aides that can come in and say, even if they live around here, they have to go to work. But mom's just not quite ready to be alone completely all day. And we can send those referrals out and give that information out as well as a resource.
Yeah. And I was thinking too, usually they, when they send you home, they send you with a, recommendation, do this follow up in 4 weeks or 2 weeks or whatever. And then they want you to get in touch with your primary care doctor. And I know when you have a great primary care doctor, that's wonderful. But as you call the doctor's office and say, well, mom just got home from the hospital and supposed to see Dr. So-and-so in a certain amount of time. Well, we're booked out like 6 weeks or 8 weeks. And, your instructions are supposed to be like within a week or something. This is the area that you're also hitting into with transitional care, right?
Yes, absolutely. So we like to go out within the first 7 days. The first 3 is ideal because then you get the home care and things that you need. But yes, within the first week is the ideal sweet spot, so to speak. Yeah. And then we can also call and help get you into your primary, because a lot of times if a provider's calling and saying, no, I'm out here with, patient A, they need to be seen before the 6 weeks mark. Sometimes we can find that wiggle room.
I was smiling as you said that because I had years of experience calling a local drugstore to check on my mother's prescriptions. And it would always go into this menu, like press 1 if you're a customer, but press 2 if you're a medical provider. And I was always thinking like, well, would that jump me to the head of the line?
Yeah, they'll answer me if I push 2. Yeah.
I was going to say, you probably get a higher level of respect when you call in and say, listen,
sometimes we can squeeze it in there like that. Yeah.
Yeah. No, it's important. And I guess the most valuable thing that happens in this transitional care is you're backing off a lot of the pressure on the family, right? Because not only are you, one part of, I'm sure what you're doing is you're kind of being an interpreter, because you can read the stuff they send you home from the hospital and then explain it to the family in a way that we can comprehend it, as opposed to running over our heads.
Yeah, because a lot of those discharge instructions are what I call med speak, and we have our own language, so a lot of things need to be explained more.
Yeah. So I think there's a lot of reasons why this makes a lot of sense. Number one, it's first, probably always the primary goal is patient safety, because I know if you think you're a good caregiver, then the thing you're probably most afraid of is I don't want to goof anything up and cause mom or dad or aunt or uncle to have to go back to the hospital. And as you said, that's a very real challenge, I guess. And what if you are literally living by yourself? A lot of folks do live by themselves, and then you don't necessarily have even somebody that you could rely on who could be there kind of to help you navigate this. It seems like another area where you fit in very, very beneficially.
Yeah, a lot of the 55 plus communities, or like you said, a lot of patients still live at home. of course, the goal is always to keep them in their home, safe and happy, and not back in the hospital. But they need that extra help to get that. And like I said, it may even be just having a physical therapist in there once a week and then a nurse in there once a week for 4 weeks. And that gets them back to their main baseline before their UTI infection or before they fell. And then we look at things too, like, falls. Do they need a different kind of shower? Did they slip because they were trying to step over a bathtub? So when we're in the home, it gives us a completely different perspective, and we can help refer out to all those places that can be beneficial to them to make them safe at home.
You and I have talked about this before because I'm a real fan of what you do because you go to the patients' homes, and I know I've shared this, and it's certainly not the first time you heard it. Like we would listen to mothers complain a whole week about everything that's going on, and then we knew, well, okay, save this up. We're going to go see the doctor on Thursday, and then you're going to be able to unload all of this, and they're going to be able to help us figure out what we're supposed to do. And so Thursday morning, everybody's taking a shower. They're all cleaned up. They're excited to go to the doctor. We get to the doctor's office. Doctor walks in. How you doing? I'm fine. and so then somebody has to be the snitch and say, well, let me tell you, this is what we were hearing. But what's wonderful is because you go into people's homes, you're actually able to identify what's going on. And I think the people are in a comfort zone, so they're less likely to put on like, oh, I'm fine. And it's not a social outing. We're really trying to get some medical business done so that we can help this person as much as we can.
Right, correct. Even to the point of, a lot of times it's embarrassing to go. You see your doctor 2 or 3 times a year, and you don't want to go in and say, "Oh, I'm having urine leakage." Yeah. But when we go into the home, we know that pretty quickly. Yeah. So there's things that they're not going to bring up just because it could be embarrassing that we can see once we're there.
And it's also the experience that you bring because you know things to look for. So rather than just having, a well-meaning relative or friend, who's willing to take the time and honestly try and do the best we know how to do, we don't have that clinical eye that you have, and you can spot things and maybe head things off at the pass if something isn't going right on the recovery or something else needs to be included in it.
Yeah, and my team, we have a lot of experience with my other provider was a home health nurse for many, many years. And then on the acute side, I was a CVICU and an ER nurse for many, many years. So we can look at things from a medical standpoint that may be missed otherwise, and certainly could be missed in a clinical office. Yeah.
Yeah, because the time you get with a doctor, we've talked about this too, the time you really get, even the doctor's well-meaning, they have so many things on the schedule. And that's one of the things you're able to do is really invest a little bit of time and make sure it's going the right way.
Yes, we do. Every patient is different. Some patients may need 20 minutes. Others may need an hour and 20 minutes, and that's what they get with us.
No, it's fantastic. So another thing that you guys do, which I'm fascinated about, you and I just started talking about, we're actually throwing this into the conversation, is you do memory screenings. And I thought, what a neat thing to do, because as we talk about in the Helping Seniors world, getting early information is your best kind of like protection, best defense that's there. Talk about what you do with the memory screenings.
So the cognitive evaluation is something that Medicare is recommending to be done every 6 months. It evaluates depression, anxiety, and then cognitive impairment. They give us tools to use, a set of different kinds of questions, and we go over all of those. And again, we're in the patient's home, so it's not like they have to hurry or think about it, or it's more of a friend one-on-one talking. And we do all of those things. We also include a med rec with that because there are medications out there that our patients are on, and it can cause confusion. It can cause, I know it makes me crazy, but like all of the sleep aids that are over the counter, a lot of people think, oh, it's over the counter, it's fine. It is not. Most of those sleep aids have Benadryl in them, and that's contraindicated for anyone over 65. So there's things like that we know that we can look at. We do a med rec, and then we can give that report to the patient or to the patient's guardian. If they want it sent to their primary care, we can do that also. But and especially in an assisted living, it's great for the facility because they're going to know exactly what that patient needs. It evaluates activities of daily living and functionalness, not just memory. So you might know the date and the year just fine. You know your name and where you're at. But when it comes to a judgment and insight, your brain's not quite working. And part of that test will look at that. And if you weren't tested for it, you won't know until it's much farther down the line. And if you get diagnosed with any kind of cognitive impairment early, there are things that you can do, different kind of memory tests or memory things that you can do to help stop it. There are medications that can sometimes help the progression of the disease. Obviously, there's no cure for that at this time, true dementia, but there's certainly things that we can do to help it.
And I just want to say, we have a corollary. We say, don't try this on your own. But our second corollary is don't be an ostrich and stick your head in the sand, because a lot of the aging things don't get better with time. And in fact, what I have picked up on the memory side of things, you're so much better to understand where you are. And you talk about, like a lot of the assisted livings, have you come in and do these evaluations on residents from the standpoint that they want to get a baseline. They want to know, where are we from? So they know when something is starting to move off scale or something like that. Am I saying that right?
Yes, that's correct. And it also helps too, because as we get older, we do get infections, and infections in an older person look very differently cognitively than in a younger person. They get more confused. They get, they may not have any pain with like a bladder infection, but all of a sudden they can't find their way back to their room, which is different for them. Yeah. So if they have that baseline from the get-go, and then it's looked at a few times a year, it helps the facility differentiate between, should we be looking for an infection somewhere, or is this a true decline in their cognition? Yeah,
and the other thing that you and I were talking about this before the show, which I thought was pretty fundamental, is I said, because you are administering the evaluation, you also are able to look at things like the medications and go, well, this might be adding confusion, or there's things that to look for that somebody who didn't have that background themselves as a geriatric practitioner wouldn't necessarily know, like this could be something that's fueling this and it's looking like this, but maybe if we backed off or made some adjustment, we're not going to see all that much of a problem.
Right, that's correct. And so when we go out and do all of that, we make that recommendation with our report. And then my other provider is actually a board-certified psychiatric mental health practitioner. And so if there is something that's going on, say there's an underlying grief situation, grief and stress can cause people's memories to malfunction, let's say, where it's not a true dementia. And he can look at those things too. So like if I would go in and see all of that, and then I think they need that, we can use that backup along with their primary and give all that information to them.
That's probably why you called your company Senior Solutions Mind and Body, because you really are looking at the whole person and trying to bring all of it under best care. So if we come back to and we talk about transitional care, or whether we're talking about the memory screening and people have questions, I was asking you before we started the show, I said, oftentimes I'm sure it must be, maybe if it's an assisted living facility or something, they may be calling you in, but the families can call you directly and say, hey, I like what you guys are talking about. I'd like to get some help. They can call you directly.
Absolutely. The families can call patients themselves if they live alone and they think, oh, this is great, I want this. They can call directly. You want me to give our number?
Yeah, please.
It is 321-429-2677. And then we also have an email that you can email us at. It's SESOmindbody@gmail.com for generic questions, things like that. Or if you want my nurse to give you a call back and arrange an interview, we can do that.
Yeah. So it really seems important. The thing to do is don't stick your head in the sand. Get a call. Do you want people to call you even if they may not need your service right away? They may be like, okay, the doctor scheduled me. I'm just saying this, making this up. A knee replacement. I'm going to go in July. When should they call you and talk to you about transitional? Do you call like a month out, or when do you want people to get in touch with you?
I would say if it's for a TCM visit, yeah, they would. They could call us like a week or two prior to their surgery date.
Uh-huh.
Because if I know what the surgery is, a lot of times I'll know that, did your doctor talk to you about rehab yet?
Yeah.
That kind of thing. And then that way we can reach back out to them, or I can reach out to the discharge planner ahead of time and say they want to do a TCM visit. So.
Yeah, TCM meaning Transitional Care Management. We live on the Space Coast, so we have an acronym for everything.
For everything,
and
yes.
in the medical world, you guys really have to speak a lot of shorthand. But I was thinking, this is really good because what you're going to do is you're going to give the patient and the family a lot of peace of mind if they get a hold of you before somebody goes in for that hip replacement or whatever that procedure is, because you're also going to be able to advise them from your own medical background kind of the things that they're going to run into, and so that you can plan ahead and make that journey as smooth as possible.
Yeah, because they may, like you said, if they have a hip replacement and they have very low toilets, that family member could go ahead and get them a riser and make sure that when they do come home, they have the equipment they need, and we can have those discussions.
See, it's the value of having expert help is really what it comes down to. That's what we talk about so often in the Helping Seniors world. We're talking with Tami Leeberg. She is board certified geriatric nurse practitioner. Her company is Senior Solutions Mind and Body, and we've been talking about transitional care. I really want to thank you for taking time to share this. You have a great website. It's Senior
Solutions mindandbody.com.
Yeah, great resources there on the website. And one more time, your phone number?
321-429-2677.
All right. Well,
thank you for having me, Kerry.
No, thank you for being here with us. And that is about the time that we have for the Helping Seniors television program on today. This is really what our mission is to get you information, get you ahead of that aging curve, so you're not just paddling like crazy to try to catch up. Let's get a plan. Let's do this the right way. Let's learn how transitional care management can make a difference before we get in the hospital, or even if we're watching this and we're in the hospital, it's not too late to give a call for that. So until next time, thanks for joining us for Helping Seniors.
Thank you.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.